Hey friends, Dr. Cooper here, cultivating a climate of wellness. So you may be dealing with acid reflux, or maybe you call it GERD. Today, let's talk about the causes, the symptoms, and of course, we'll discuss the Harmony Way. Acid reflux or GERD is a medical condition that could cause symptoms like heartburn, regurgitation, frequent belching, gas pressure, throat irritation, and hey, even sometimes palpitations. Guess what aren't symptoms of acid reflux? Things like shortness of breath, sweating, upper stomach pain while the stomach is empty. So, what is responsible for this terrible feeling? Well, there are many instigators and there are a few different causes. Some things that may be instigating this acid reflux are things like over-the-counter medications like NSAIDs, or obesity, pregnancy. Also, high fatty foods or high acidic foods, maybe even be alcohol and even carbonated beverages. Though the true cause is not often explored for acid reflux, there are quite a few different culprits. Some of them may be dysbiosis of the gut or overgrowth in certain bacteria like H. pylori. Some may have injuries to the diaphragm muscle. Some causes could also be things like chemotherapy, and may be associated with other things like stomach ulcers. Well, guess what? 50 to 90% of people with acid reflux also have a hiatal hernia. So you may ask, what is a hiatal hernia? A hiatal hernia is a portion of the stomach that pushes through your diaphragm muscle, resulting in a bulge in your stomach through your chest wall. Guess what happens? If you have a bulge of your stomach through your chest wall, your sphincter that should open and close effectively, it cannot do so. This results in foods that should be in the stomach getting the opportunity to travel outside of the stomach. And this results in an acid sensation that you're getting in your throat, and sometimes just frank regurgitation of stomach materials. Sounds tasty, right? So, what's the Harmony Way? How do we treat patients with acid reflux? Phase number one is we fix your plumbing. A proper diagnosis and evaluation with your provider, in addition to a detailed history, will help us identify if you have a truly high stomach acid production issue, or if you have food and acid materials getting trapped in all the wrong places. Next, we want to check and see if you have any bacterial imbalances in your gut. We also want to know if you have any digestive issues. Next, if we have confirmed that you indeed have a reducible hiatal hernia, it's time for us to perform and teach you some maneuvers to safely self-manipulate. Okay? Did you know that most of us are breathing backwards? This may be contributing to your symptoms as well. We may want to teach you how to breathe better. Next, we want to ensure that you're having proper gastric emptying, that nothing is slowing up your bowel movements. By the way, what positions are you in 30 minutes after you're eating? Fixing your posture may also be an important part of reducing your acid reflux. This brings us to phase two. Phase two is time to fix the pipes. You may be encouraged by us to do things that are gut soothing, like aloe vera or chamomile. We may also ask you to avoid triggers like certain foods or even stress. And hey, don't forget to poop. If you're not draining your pipes, undoubtedly they'll overflow. Phase number three. Now we may encourage you to consume some products that could assist in lowering your pH, which means increasing your stomach acid. Herbs that promote motility and digestion, we may encourage that too, like ginger, or we may encourage things like apple cider vinegar. Folks, this is the Harmony Way. And if you like to hear more health topics, the Harmony Way, drop a comment below. If you want to tell us about some of the things that are working for you, drop a comment below. We love to know what helps. Look, I'm Dr. Cooper. We're cultivating a climate for wellness. See you soon.